Now we are ready to jump in the topic of the modernization in healthcare in the next 5 years. And we invited Aaviksoo, who is the head of development and partner of HEBA Clinic, coming from Estonia, to actually set the stage a little bit for the 2 days of the discussion about the fact how the healthcare can catch up on the other sectors. Ain has over 25 years of experience and consults internationally the companies and governments, and is joining us today to tell us a little bit how can healthcare overcome the struggle of adopting digital universally. And he will also look at those challenges and see how we can overcome them. Ain, it's great to have you here with us, so I will pass directly to you. And for all of our audience, please know that we welcome your questions. You can post the questions to Ain in the question box on the platform. We hope to have a presentation and also leave some time for questions. And for all of us, we have to be very strict with time, as the platform will cut you at the end of time. So without further ado, Ain, I'm passing the mic to you.
Good morning, good afternoon. It's quite interesting to tell, after 25 years in the business, an introduction to digitalization. And I'm quite sure that most of you actually are doing and actively enjoying the benefits that the digitalization can bring. But as Bledin and Carolina mentioned, I have the luxury and also privilege to share a journey that I have myself been part of as the former CIO of the Estonian Ministry of Health and Social Affairs, but also have been working in several countries and organizations, and currently work in a clinic as a head of innovation. Also started my third startup just a few months ago, proud ambassador of ECH Alliance and also senior health advisor for Noto, with whom we are actually helping in the Middle East the digital transformation to come live. I will start and tell the story in 3 parts. Healthcare is about data. And also we know that data these days is more and more digital. I started my medical studies in Estonia in 1992, so that's quite a long time ago. And yes, indeed, it was a very enthusiastic period for myself as a member of a nation who just regained independence, but also because I could start a new life as a student away from home. But also the whole digitalization started at that time. We had paper folders. We made notes in the hospital wards. And one famous example that I remember at that time, today my good friend is an established surgeon in Estonia. And one daily note that he wrote, I think he was a 4th year medical student, into this paper chart was that patient healthy period eats soup, period. And if any information system would capture this kind of data feed, probably they couldn't make sense. What does that mean? But if one would tell you the context, that this was a patient 3rd day after gastric ulcer surgery, and this was a post-operative period, then if on the 3rd day the patient is healthy and he's eating soup, it means that the operation was successful. So that the idea is that even though the paper was seemingly a poor way to convey information, actually for healthcare professionals, it was very well organized and still is very well organized. And therefore, we should not forget about this very nuanced context nature of health data when we go to the digitalization. Now, this is the picture of healthcare today. Carolina mentioned that these days we don't remember and even choose. I know my children, they are swapping bunks if the older one has a poor UX interface with the mobile banking system. I do know that in many countries, including myself in Estonia, we have the luxury that not only can we do our banking whilst being in a hospital bed, for that matter, we can actually engage in our daily activities, make appointments and referrals, see my health history, book for vaccination, and actually do many things. Now, for healthcare, this journey started. It did actually start, as I mentioned, in 90. Estonia had digital identity. We had data exchange layer, and sometime around the first 2-3 years in the beginning of this century, 99% of primary healthcare records were digitized. In 2008, we launched a nationwide health electronic record. E-prescription came in 2010, I believe, and telemedicine services started to move on. We today have personalized medicine. We can integrate genomic data with the clinical decision support. And among one of the first countries in Estonia, we also enabled cross-border health data exchange in the EU. And when the COVID crisis, digital contact tracing and testing solutions. And today there are AI-based decision support systems that help clinicians to make better informed decisions. And this is something that actually has been a result of many years of development of many people. And the result of that is that healthcare data grows exponentially. So we used to have 100 pages in 1992. By the around the verge of century, we had around 1,000 data points for basic electronic records. For more complex electronic health systems, there are 10,000 data points. And today, the integrated health data with all the mobile data feeds, roughly, we could say that at least an order of the magnitude is larger. So, and it also means that at any given point of time, for any person, the future already is here. It's just unevenly distributed. We still do use paper in countries who maybe jumped over the other countries' kind of legacy systems that we have today in the computers. In many African countries, all the systems will start working from the mobile from the start. And the first part, I will end with a data paradox. So have you thought that did digitalization make more data, or did the growing complexity of medicine demand digitalization? And actually, the answer is both. So that more data leads to more digitalization because we just cannot comprehend it with our human brains. This enables more sophisticated medicine, and this again, in result, creates more data. So I will now move to the second part, which is that if we know that there is a lot of information that has always been, doctors need it, we should bear in mind that information is there not just for the sake of having it more and just in case. It should serve the decision making. Now, a survey done by McKinsey just a few years ago predicts that in Africa, on top of the existing healthcare developments, if also good and purposeful digitalization will be added, 4 to 14% additional healthcare expenditure efficiency gain will be achieved. So again, my question is, is any digitalization guaranteed to deliver this result? And I will answer myself, and hopefully most of you have experienced that yourself, that data per se does not equal information. And also any information does not lead to good decisions by itself. There is information overload, not just for school children at home, but also for doctors and nurses in a hospital. Another recent study told that if you give more alerts in a healthcare context, and then actually the adherence to those alerts will decrease. It will decrease over time, and it will decrease with more and more alerts provided. So that when building digital health systems, one of the challenges is to understand, okay, what is the value in terms of better decisions? And is that larger than the cost to actually deliver that, either in terms of time to capture and to read and analyze the data, the resources that are required to store, to build those information systems, and also to the cognitive load that we all know is something that we are challenged on daily basis. So the conclusion for me, and again, comes from a very practical experience, is that the actions and the data quest are actually the result of meaningful questions. So that if you have a certain question in mind, certain decision in mind that this digitalization will support, actually you can build a wonderful information systems. And on the right-hand side, you see one of the information systems that we created in Estonia, which started as an IT project, where the coordination between healthcare and social care was poor. The elderly people living alone at home did have on every Wednesday, knocking on their door, the social worker, the nurse, the volunteer, their social counterpart, and then the rest of the week, nobody showed up. So the first idea was that, oh, let's build information systems so that these specialists can run around with the gadgets. And actually, by introducing designers, we came up very quickly with a very powerful information system, which was stuck on the refrigerator of those elderly people, where each of those individuals visiting that person marked in the calendar when they will do, what will be the engagement with them, so that the rest of them could coordinate. So that digitalization actually starts by understanding the underlying problem. And I will finish this session by inspiring, how do I see not just Estonia, but I'm pretty certain the world in not that far future, where, for instance, large language models already can help medical experts in clinical text summarization. We know that there is a European health data economy that should be based on a much better integration of the data across many countries and many domains, and made available in a privacy-preserving manner, but also in a way that it actually does drive new innovations. And engagement of patients is much better possible than it was in the past. But I'd like to emphasize here the part that if we can reduce the administrative burden, which currently is 40% of the total workload of nurses and doctors in a hospital, we will do a lot and a great service to those professionals. More time they can spend with the clinician. So this is something which can be achieved already today. And the last bit, unfortunately, we still need to talk about the money. Now, the system rigidity is what prevents all those cool digital solutions to actually spread across countries and also globally. So what do I mean by that? If you ask any manager these days, do they see more money and do they see more need for digitalization? Everyone will say yes. And again, we can throw a lot of money into building these solutions, but we also know that everyone wants to progress and nobody wants to change. And this analogy of a rope, actually, somebody told me when I was in the position of the chief information officer in the ministry, is that if you can only push the rope, it will actually wrinkle. And you also need people and activities that pull, and therefore bringing together different people and understanding that digitalization without policy change is just another cost driver. So in order for all those cool things that you're going to discuss over these 2 days and after this conference, hopefully, reimagining healthcare economics, going to value-based healthcare, redefining professional standards, how different professional layers and specialists talk and communicate to each other, but also reshaping data governance. Most of the time, the doctors and nurses are using data that has been provided by someone else, whereas actually most of the time, the data that they create during their interaction is used by someone else in the future. Transforming health workforce, new skills need to be taught. And then, again, last but not least, reactivating the patients, because they are the true healers in the system. And the term patient should be perhaps even replaced with something else, so that patients should not remain patient, but actually become an active participants in it. So I would close my initial discussion by telling you something that I learned from this now more than 25 years, is that in healthcare, you cannot make decision without data. But also at the same time, you have never enough data to make that decision. And as a doctor, I still remember and know that if a patient is looking at you, they're expecting you that you make this decision, sometimes life and death decision, and then the wisdom and the empathy is there, which will actually complement the data, regardless how much you have it. And second part is that we do need technology to advance, but the most precious resource in healthcare is doctors, nurses, and all other healthcare professionals' time. We learned just from the recent history, you can print more money, but you cannot print more time for professionals. So that every digital solution that is introduced must carefully consider, do we actually introduce more time for doctors and nurses to actually do the work that they are better as human beings, or do we force them to either do more things to capture this information or read yet another guideline or a bit of information, or we can build a system where they can actually make quicker decisions with the help of digital technologies. Mm-hmm. So I will finish this by wishing you all to have digital force with you, and happy to take the questions.
Yeah. Thank you so much, Ain, for the inspiring presentation that will give us a fantastic background for the next discussions. Unfortunately, we get the message that we don't have time for the questions as we have to move to the next session, but we will pass the questions to Ain, and we will also try to respond to them during the next 2 days. There was also a question if the slides will be available. The recordings will be available, so please subscribe to ECH Alliance on YouTube for the recordings. And thank you again. And after a short break, we move to the next session.